great days, back to school edition. Now it's time for a little health and science lesson. For many kids, this will be the year to get some things straight, mainly their teeth. Whether it's the traditional metal braces or invisible trays, there are options to get that perfect smile. Here to explain, please welcome orthodontist Heather Brown and her patient, Taylor Redmond. Hello. Let's first explain the difference between just a regular dentist and an orthodontist.
Well, basically, after completing dental school, you're a dentist. So after I completed dental school, I became a dentist. A dentist basically focuses on cleanings, drilling, fillings, things like that.
Basic maintenance and
right,
stuff.
basically.
And some cosmetic procedures.
In order to become an orthodontist, you have to do advanced training. So I had to do 2 to 3 years of an orthodontic residency in order to become an orthodontist. And we basically specialized in straightening teeth with braces and correcting the alignment of the jaw.
Yeah, and sometimes that's done for simply aesthetic reasons. Other times it's done because there's you could have pain and other things associated with a bite that's off.
That's true, exactly.
All right, so you had to get braces.
Yes, ma'am.
And you just recently got them off?
Yes, I got them off about
a couple of weeks
ago. Yes.
Yeah. Okay, so why did you get your braces?
I got my braces because I didn't like my smile very much. My top teeth, they were okay, but my bottom teeth were terrible. I had one tooth sticking out in the front.
Yeah, one tooth that was on its own plan.
Yes,
yeah. Every now and then we have one that goes haywire, right?
Yes.
Yeah. So you decided, out of curiosity, how young can you decide to put braces on a patient?
Well, we actually started seeing kids at the age of 7.
Okay.
When they come in at that age, we can do different types of appliances to prevent them from having to have teeth removed later on in life, to prevent them from having to have surgery, and things like that. So it's good to see them at the age of 7.
Yeah, because you can also decrease the time that they might have to wear the braces.
Exactly.
Okay. You opted to get the metal braces, the traditional metal braces. Yes. Why?
Because I like to solve them. I like changing the colors, and it's just fun for me.
Yeah, you were just having fun with it. Yeah, Christmas time, the red and green ones, or you get school color ones and the whole bit. And so there are some kids who are certainly comfortable with having the braces. And by the way, your smile is beautiful right now. I can see though she has a...
She has the invisible retainers on.
Okay.
Those are the clear retainers. And I'd like to mention that Taylor, even though she had the traditional metal braces on, she was recently crowned National American Miss Most Photogenic 2012.
Yeah, and she is. She's beautiful. And you did it with your braces. I love it.
Right, she did it with the braces.
All right, so there's the metal braces. Now, she mentioned she's like trading out all the rubber bands and stuff. Then there are the metal braces that have like the clear.
Right, you have the clear braces with the metal wires.
And then you can actually get the whole clear braces that look kind of like, there's an example of that right there.
Exactly.
So you just don't see it quite as much.
Right, so those are more popular with adults, but the only disadvantage to those is that you still have that metal wire that some people don't actually like to see.
Right. Okay, and then we have what's called...
this is the new SimpliClear.
Okay.
So with the SimpliClear, the wire is actually completely clear. This is actually the world's first completely clear wire system. And this product is actually made out of Singapore. These wires are custom made by a company called Biomer's in Singapore. And this product actually just hit Houston in 2012.
Okay, pretty cool. So you can get that. And then, of course, there are the things called Invisalign, which I have right down here on my bottom teeth to straighten them. And Invisalign works a little bit differently, but explain to us how this happens.
So with Invisalign, there's a series of clear aligners that you trade out, and you change into a new aligner every 2 weeks. So if you notice on the picture there, the top model does not have the aligner on it. If you look at the lower one, it has the aligner, so you can see how invisible it really is.
Yeah, because my teeth, I don't have one on the top, I have one on the bottom. It's just really simple. You pop it out whenever you have to eat. I'm going to do that right here. There you go. There it is.
Good. You're a great patient.
There we go. Right there. Okay, so what would be the advantage for one over the other?
Well, basically, with any of them, they pretty much work the same. It's just a personal preference. So all of them are basically the same. It's just whatever you prefer.
Yeah, and of course, you have to be diligent with the Invisalign. You got to wear it.
Right, exactly.
Take it out when you eat. You got to brush your teeth and put it right back in.
That's true.
Okay. The other thing that people kind of hesitate on when they want to go in and get their teeth aligned is that impression that needs to be made. You know when they have that pink squishy stuff that you have to bite onto, and you're like, you got to stay still like this, right? And it's like bitter tasting and the whole bit. Gone are the days that you're off.
Gone are the days. Say goodbye to impressions. So basically, a lot of people don't like impressions because it causes gagging. It's uncomfortable. It's messy. So you can see Taylor is very uncomfortable with taking her impression.
Yeah.
And actually, we had a little bit of trouble because when we were taking the impression material actually started setting up because she didn't want to open her mouth.
Okay. So then you're not going to get a true alignment.
Right. We would have had to retake that impression for her.
Okay. So, but not anymore.
Not anymore, thanks to our new digital impressionless scanner.
How does this work? I mean, so you basically just you'll go in and what?
So basically, if you look at what's
Yeah,
happening
there
with
you
her, you're going in with this handheld wand, and it's a camera that's actually inside here with a laser light. There's no radiation involved, and the images are captured by this camera, and a 3D digital image.
Love it.
Right. Is actually
Which means it's
composed.
probably more perfect, too.
Right, right. So it's comfortable for the patient. You don't have to worry about the impression material, the bulky trays. It's very, very comfortable, and the patients love it.
Yeah. For the next few weeks, this is a good time to make your dental appointments
That's
because
right.
you don't want to have to yank kids out of school. Although the kids will be saying, no, that's okay. You can take me out of school. Right. Yeah, take them out of school. So get that done. How often should kids go in particular, and get their teeth checked?
Well, at least every 6 months. You need to see your dentist every 6 months. And then the dentist will make a referral if it's time to actually see the orthodontist.
Yeah, all right. If you would like more information on Dr. Heather Brown's orthodontic offerings, just call this number, 713-665-4455, 713-665-4455, or log on to drheatherbrown.com, drheatherbrown.com, and get this, Dr. Brown has an extra special offer for Great Day viewers. The first 30 callers will receive a free exam and $1,000 off Invisalign or SimpliClear braces. That's very generous. Thank you very much. So $1,000 off. Get those teeth straightened out, and really sooner rather than later, right?
That's right. That's right.
Okay. For our studio audience, you're all getting a free backpack loaded with school supplies. Thank you very much for that. You look beautiful. Look at that smile. Smile big for me right there. Let's get a close-up shot. Smile big. There you go. Right into the camera, Miss Photogenic. Close-up. Bing! Thank you. All right, up next, now that we have your teeth straightened out, let's do some straight talk for curly hair. When we get back, how to embrace your natural curl.